Hello, everyone. This is the Rare Disease podcast. I'm having a conversation with the lovely Megan today, but I am, if anyone's watching on YouTube, I'm currently working out whether to wear my glasses or not. I now have reading glasses. I've reached that point in my life where I went to have my eyes tested, Megan, and
Yeah.
they were like, good news, you don't need your old glasses, which was good because I'd lost them. Like,
Okay, handy.
like everything. I'm not allowed fancy things. Anyway, but they were like, bad news, your eyes are aging, so you now need reading.
Oh no.
A moment in your life where you become myopic. So you've gone from needing long distance glasses to short distance. So it means I need them for reading, and it's put me in a right swell, partly because look, I'm getting glare.
Yeah,
I'll squint. That's what I'm gonna do.
same. I've had to accept the glare.
Your glare doesn't seem so bad. I think it's maybe the position of my screen.
Yeah, I don't know.
But anyway, thank you for joining me, Megan.
Thank you for having me.
For our listeners who may not have come across you yet and met you, would you give yourself a little introduction?
Absolutely. So, hello everyone. I am Megan Perlin. I have recently joined Medics for Rare Disease as a research project manager, focusing on our Lancet Commission project, so the RDI Lancet Commission on Rare Disease. So my background is in scientific research. So I've worked in drug discovery in the labs for the past 7 years. And then I've been doing rare disease research for the past 2 years. So yeah, kind of working in the lab, doing preclinical stage research, but very excited to be moving outside of the lab and getting involved further in the rare disease community and getting involved with the Lancet Commission, which is going to be a very impactful project and looking forward to working on.
Yeah, thank you, Megan. We're very grateful to have you, a lovely man named Bruce, who you know who you are, put you in touch. So you're
Yeah.
you're wanting to move. Did you used to wear like a white lab coat?
Yeah, white lab coat, the whole lot.
And
Gloves, the goggles, pipettes. Yeah.
a teeny tiny clear minuscule amount of fluid from one teeny tiny little, what are they called? Those little tube things called?
Like little test tubes.
Yeah, like
Microcentrifuge
which are the
tube.
ones you put in a centrifuge?
Microcentrifuge tubes. Yeah.
So teeny tiny.
Yeah.
Good from one to another. I did in my genetics degree, I did some lab work, and I have to say, as an ADHDer, undiagnosed and unmedicated, I just used to spend the majority of my time being like, oh, have I already put liquid in that? Have I?
Yeah.
But,
Those like tiny little wells and like 384 of them in a tiny little plate like this big. And it's, clear liquid. And you're like, oh no.
Did I? Honestly,
I don't know.
Someone should have diagnosed me then, but I
Mhm.
couldn't let them know I was having difficulty because then I'd have had to start my experiments again. So it was just easier to do poor experiments and a really good write-up.
Yeah.
But hey, I think someone else managed to do some sequencing of the SCL gene in an axolotl. So
Perfect.
they weren't relying on me to really make that scientific jump. But anyway, we're glad that you've made this scientific jump into communications and running this project. So thank you for joining me today, because we're going to talk about the commission by the Lancet. And I would just like to say that to the audience, we're on a learning curve. So I might have mentioned that I got told to turn up at this mysterious place in Geneva, and then was told that I think they had told me things beforehand. I hadn't really definitely understood what was going on. And then I got there, and it was basically like some kind of secret society. No, it wasn't. It's very well known at the time. So it was like a secret society of people from all over the world in rare disease. And I was a bit like, how did I get invited here? So anyway, I've been on a learning curve, and Megan's on a learning curve, and we're hoping to, sort of, what's the word? Gift you what we've learned so far in our mission to basically run this part of the commission. So let's start, Megan.
Absolutely.
I trust you with this.
Thank you.
I know about the Lancet. That's an important journal.
Yeah.
medical journal. It's quite prestigious. I know about the Lancet, and I knew about their commissions only as much as I mostly knew about the climate change one.
Yeah.
So therefore, I've charged you with finding out what is a commission by the Lancet, Megan.
Yes. So a commission by the Lancet is a in-depth research initiative. So they bring together experts such as leading scientists, academics, policymakers, clinicians, and also community representatives from around the world to represent global health issues. So they're looking to address urgent and complex health priorities. So the goal of the commission is to really make impactful recommendations for action to improve policy for health systems or just implementing an action really that will make change.
Yeah.
So like you
Are
said,
they usually around health then? Because obviously Lancet is a medical journal. So
yeah, so I think they have the global health focus, but they do so some of the commissions they've done in the past have been, like you mentioned, on the health and climate change, COVID-19 as well, and global mental health. They've also done a commission on food, planet, and health. So this was done quite a few years ago. So it is focused on global health issues, but I think also looking at things that can contribute to global health issues like climate change, the planet, etc.
yeah, I once heard someone from the World Health Organization speak about climate change and health. It was like, if you look after health, you look after climate change. If you look after climate change, you look after health.
Mm,
They are one and the same.
yeah.
I think this every time I live on the M40, but go into London quite a bit, and my grandparents used to live closer to London and like Wembley and Harrow. And you get to the A40, and I was just literally sat on the A40. And if you don't know this road, it's basically like an elevated motorway that's an A road, but it's like two lanes on both sides. And the houses, I'm pretty sure, existed before the motorway. And you're talking like a
Mm,
few meters from the top windows of these houses to the
yeah.
motorway. And I mean, I think there's some judgment out there, around whether people smoke and if people deserve things, if they do certain things in their life,
Mhm.
which I don't think that's my job in life to judge like that. But, these people could live on these houses that they own and maybe don't have the ability to move, or that's the place where they've been put. They can live in these houses. They can live the most impeccable life in terms of behavior and looking after their bodies. They're basically smoking pat
Yeah.
children. And it did just strike me after all this work that we've been doing that some put that motorway next to those people's
Yeah.
houses and
Yeah,
thought,
like rush hour
okay.
traffic. Yeah.
And it's like, so things like that are really important
Yeah.
because I'm sure most people didn't say, hey, what we want is constant, like, blocked traffic with all of those
Mm,
emissions coming out of those exhausts sitting next to our house day in, day out while we bring up our families. I bet they
yeah.
that. So, yeah, really important. Anyway, sorry, I
Yeah.
went off on one then. It's because I drove
That's
into
absolutely
London the other
fine.
day for the ambassador. So
Yeah.
I
That's
felt really
completely
bad.
fine.
So, yeah, so in our case, we're looking at rare disease, obviously.
Yeah.
So, why has the Lancet got involved? I think the answer is through, advocacy is never done by one person alone, or
Mhm.
at least it doesn't continue. It grows and grows to get to this level. So lots and lots of work has got us to this point from people that we will never even know the names of and won't be remembered for it. But we know that they did it and we know they existed even if we don't know them and see them. But also Rare Disease International has really been on a long journey towards this point. I feel like
Yeah.
I've sort of just jumped on the bandwagon at the end. So I want to give a huge shout out to Rare Disease International. And
You've done
that's
incredible work.
yeah. And that I think that they're they run sort of the rare. there's lots of campaigns, including Medics for Rare Disease campaign on Rare Disease Day, but Rare Disease Day, the International Rare Disease Day, I believe is run out of Rare Disease International. It's an advocacy group that provides sort of a global united voice for people living with rare diseases and those who are impacted by rare disease. And I have to say that their profile, their brand has just been building and building over the last few years. And they're really like taking that position as a global group. And I love that because we need it. And so the Lancet is working in partnership with Rare Disease International and launched the Rare Disease Commission to shine a spotlight on the challenges faced by this population, which is estimated to be 6% of the global population who are directly impacted. So as in like they live with the condition, let alone the millions extra. So, I mean, a conservative number for people directly impacted, 400 million. But if you indirectly impacted, but if you then think about all the families and communities and everything, it's a lot.
Yeah, caregivers and their team.
Exactly. And things, children, everything.
Yeah.
And so to provide a global response, because the other thing that we know about rare disease is that, you know, some are more common, but some are not. And you need to know about, if you're going to provide hope and connection and information and maybe and research, you're going to need to join up people from around the world, not only the individual cases in inverted commas, but also the expertise, because you need to share all that expertise. And looking nationally alone is going to get people very far.
Yeah.
So challenges that we're talking about here are, like I've just mentioned, the individual low prevalence of each condition, the diagnostic delays and misdiagnoses, meaning that you've got that low prevalence and the loss of an opportunity to find out more from the people who aren't diagnosed.
Yeah.
And then, you know, inadequate care, both prior and after diagnosis. And that includes things that aren't specific treatments. You know, most rare conditions don't have a disease-specific treatment, just like loads of common conditions. But also then there's many conditions that we've known about for really, you know, for just decades, but have very few treatment options. Sickle cell is a classic example of that. We have a known population because of screening in the UK. We just have not had the treatment options available. And when they do become available, sometimes they just get taken away again, or they might not be available for everyone. And that actually where there are treatments, it's often for a very small subset of a population. So within a rare condition, it's probably a subset of that condition as well, people who meet the criteria, and they're often very high cost.
Yeah.
And then in terms of communities, there's the social consequences of when you live with a rare condition or any chronic or long illness that isn't being supported. And this can often be more devastating than the condition itself, leading to stigmatization, people not being able to participate in daily life, in society, education, employment, coming under financial hardship because directly related to the poor care that they're receiving, and really importantly, social exclusion. And then all of that basically being underpinned by not enough information, not enough data. And if we know anything these days, data is valuable and be very important to drive change. So it's hard to know what the size of the difficulties we're really facing. So I do think it's obviously I'm going to think it's valuable, but I really do.
It's incredibly valuable. Yeah.
Yeah. And and so, you know, for us, that's quite lofty, I guess. But, you know, this is all very well intended and everything, but you coming to it a bit more outside of it than me.
Yeah.
How do you think this is actually going to help?
I think, as you said, I come from a different kind of background, so I don't have much experience with this type of research, but I think just acknowledging the amount of people globally that are impacted by rare disease. Like you mentioned earlier, that there are collectively 1 in 20 people, so approximately 400 million people worldwide, that are living with a rare condition. So I think having the Lancet and RDI, this commission, recognizing that and just putting that collectively rare disease, that even though specific rare diseases may not affect many people, that the challenges they face, as such as misdiagnosis, access to treatment, social inequalities, they are shared across everyone that has a rare condition. And I think I just want to jump actually to the mission that RDI and Lancet have put on this commission, that they want to make rare disease a priority in health, society, and research globally, and ensure that people living with a rare condition are seen, heard, and cared for. So I think having RDI with that collective voice and that recognition that this is impacting a large amount of people and it needs to change is going to make a big difference.
Yeah.
And if I'm correct, this is one of the first kind of global projects on this scale.
I think, yeah, I think so. And I think that partnership with the Lancet is really important because
Mm,
otherwise you can just be shouting into an echo chamber.
yeah,
Like the members of RDI don't need telling this. And we could build
yeah,
all of our own plans
yeah,
ourselves. Like, and I mean, like people do in their own nations, etc. It doesn't mean it's going to get implemented or there's going to be that
yeah.
faith behind it. So I think
Hmm.
that if the only thing that comes out of this is that the Lancet has decided that this is a global priority and decided to partner on this and then gone through this process, that's going to immediately highlight rare disease to the larger medical world. And
Yeah,
so many of the issues, they're not all medical, but, really we can get onto like the human rights. We will get onto the human rights later, but healthcare. But
hmm,
if healthcare isn't even seeing you as a priority when you've got all of the, when you have a long-term illness and all of these things, then really you're very stuck, aren't you? So I
yeah.
think
You're in a
that,
very vulnerable position.
yeah, exactly. And I think today these days, I think however the UK, the NHS is or whatever, I think what really shocks people in the news is that idea that you that idea of, well, if a worst comes to the worst, I'll go to A&E. That's what people think, isn't it? Like worst comes to
Yeah,
the worst, I go to A&E, and that's like this almost safe haven where nothing bad can happen. And I
yeah.
think
You're protected.
that's really shocked people over the last few years is the cases where that hasn't been the case, or
Yeah,
a girl has been lying in a park for hours waiting for an ambulance to get her, and she's just lying there because she's been told not to move because of a neck injury, but it's going to take hours for the ambulance to get there. I think that's what really shocks people, is that there is no safe place to go. And I think that is often the case in rare disease. That is just
yeah.
not a given for them. So I think
Absolutely. And I think in cases where you say, like, you go to A&E as I'm going to be taken care of, I'm going to be safe and protected, and the healthcare professionals don't know about your rare disease, they don't know what to do, so they send you away. They obviously stabilize you, but that's
yeah.
kind of a very, very difficult position to be
Or
in.
in some cases, people feel less safe going into healthcare.
Yeah,
They're potentially going to be put down a route that they know isn't right for them. So,
yeah.
and earlier this year we talked about that the World Health Assembly passed this resolution for rare. So that's at the 78th World Health Assembly on the 24th of May, and that makes
Mhm.
rare disease a global health priority. So this is
Absolutely.
really that's a massive step, again, driven by Rare Disease International and a lot of groups that got behind them, including Maybe It's Rare Disease. And the potential for this to lead to the World Health Organization developing a global action plan for rare disease, which would then hold its member states to a certain standard.
Yeah.
say this is what good rare care looks like. So you can't, we can get onto this a bit more later, but that idea of in the UK, you might receive a over £1 billion treatment, but you might not receive all of the basic requirements that you need to sort of have your integrated life, or
Hmm.
someone might have been taken off PIP, or they might not have a carer's allowance or something. You know,
Yeah.
rare disease isn't a policy area that is separate from all the others. In every policy area, we should be thinking about those impacted by rare disease.
Yeah.
So that really excites me.
Yeah. It's
Yeah.
really exciting time.
Yeah.
And I think having this commission looking into evidence-based recommendations as well, I think that's going to be key of, so obviously we're going to talk about it later, but one of the working groups looking into data, and also all of the other working groups doing literature reviews, getting that evidence, and then making actionable recommendations, I think is going to be very helpful as well.
Do you know what it kind of reminds me of? Like, when people say, oh, you get this quite a lot, especially in very evidence-based driven healthcare systems where
Yeah.
more and more rely on, if it's not got the highest standard of evidence, we
Yeah.
can't do it. And that's meant to be because of safety. But I mean, is it, or is it? Yeah, I won't say that. But safety or something. Anyway, and it's a bit like, well, you can't really get the data because, that would require joining up between the entire global rare disease workforce and patients and stuff. And it's almost like this commission is an opportunity for people to say, well, we need better data. We need larger samples. We need more. And RDI and the Lancet have basically gone, okay, hold my bag.
Yeah.
I'm going out to get it. And, and I think, and I like to think that this is how the struggle for human rights has happened. I mean, obviously, the struggles for human rights are in history have been just, they've been violent, non-violent, they've been protests, they've been all sorts of lives lost. But we have lives lost in rare disease. We
Yeah.
have, and this is the struggle. And it's, people put the state or society put, whether it's a real or a made up barrier in front of you. And
Yeah.
they go, okay, fine. Let me go work that out for you and come back. Let me go work that out for you. And
Yeah. Yeah.
do you see that struggle in communities over and over again? And I'm up for the fight. So
Yeah. Absolutely.
and also, I really admire the fact that this has to be global.
Yeah.
Otherwise it doesn't work. And so, this
Mhm.
can't be a Western centric piece. And
Yeah.
being able to work with people from truly all over the globe and making it relevant to people impacted by rare conditions globally, no matter where they live, what healthcare system they have.
Yeah.
So yeah.
Absolutely. And I think that is, yeah, key is that no matter where in the world someone lives, they want to be able to reach them with an action that can improve their care.
Should we do talk a little bit about how it's made, what the commission is made up of and our group,
Yeah.
just so people know what we're talking about.
So, yeah, what does the commission look like? We keep saying commission, but what actually is it? So, the commission is led by 2 co-chairs and a group of 27 commissioners who represent countries from around the world and have been involved because of their expertise within the rare community. So, the 2 co-chairs are Dr. Kim Bicott and Dr. Roberta Giuliani. To tackle all of the challenges, they have divided up the work into 5 key working groups. So, working group 1 is focusing on visibility for human rights. So, putting together a rights framework that is applicable to the rare disease community. Working group 2, looking into visibility for social justice, which is the working group Medics for Rare Disease are working on, and that Lucy, yourself, has been nominated as chair of, which is extremely well deserved as well. And you're doing a fantastic job of chairing that working group. So
Although I
just a
did
little
immediately employ you to do all the work.
but you are the brains and the leader. So yeah, that's fantastic. By the way, I just wanted to pause there and give a little shout out. So working group 3 is focusing on visibility in data and metrics. So kind of trying to cover that issue with not being represented within data or it being fragmented. And working group 4 are looking at visibility within the healthcare system and other sectors. So looking into how the diagnostic odyssey can be reduced. And working group 5 is looking at visibility for clinical pathways. So for rare disease, patients have opportunity and be represented within clinical trials. So all very important focus areas. And I think even though each is focused on a different priority, they're all going to tie in together into working group 1, which is looking at that visibility for human rights and applying that human right framework to every challenge and barrier that are faced by people living with a rare condition.
Yeah, and we changed our title, and it was actually after
Yeah.
a podcast with Elle Daniel about her daughter who was about to go, like, she was about to donate some liver to her daughter. And she has, and as far as I know, the transplant went well, and
Amazing.
Elle is recovering well. So sending our love to Elle and
Yeah.
family. But it was a conversation with her that I realized actually what working group 2 is about is social justice.
Yeah.
So I mean, audience, believe me, I am, my brain is learning as we go. But
Same.
essentially, so working group 1 is the human rights piece. And really what we were talking about is, okay, we have legal frameworks that are available that should protect the rare disease community, just like anyone not in the rare disease community, from experiencing social injustice. So, because their states have a responsibility to go by these legal frameworks that they've signed up to. And so things like that might be, I don't know, like a classic is a right to education. I think we can talk about which ones we knew about later, but, and yet it's clear when you listen to people, when you listen to the stories, these human rights aren't being respected on quite a large scale within the rare community. And why is that? So, and then after talking to Elle, I was like, this is actually about social justice. So it's okay, it's all well and good having a legal framework. And then it's all well and good looking at the absolute granular piece of, okay, how do we build a diagnostic pathway that really takes into account the different parts of that pathway and where people get stuck in the flow, etc., or looking at treatment and clinical pathways. But really, none of those things are ever going to be implemented in an equitable fashion if there isn't, if people are not receiving social justice, as in, regardless of who they are, where they are, what they look like, etc., they receive have their human rights observed. So shout out to Elle for that one. And everyone in our group, small but mighty,
Yes.
work group 2. I think we're the smallest group. I've brought in some friends, well, not friends, I've brought in yourself to help, and I have to give shout out to Tony Lockett at King's College London and his team, including Shams, who are helping us as well. But otherwise, we are Roberto and Juan, both from South America, and then we've got Kirsten and I, both from the UK. We live about 16 minutes apart. So diversity within working group 2 is basically South America and Oxfordshire.
Yeah.
So we obviously are getting fed in by other people. So
yeah. And I think, that's another point actually, is the collaborators. So like you said, with Tony and Shams, so each working group can invite collaborators to join the working groups to input their expertise and help with the process. But as you said, the 4 commissioners in working group 2 and Tony's great knowledge and expertise as well.
Yeah. And we're working on a literature review at the moment, and the next part
Yeah.
will be building new evidence for the commission, and then we'll build our recommendations off of all of that work. So when we get to that new evidence piece, that's when we need to go, where we get the chance to really go global. I don't think we can talk about our plans yet, but obviously with me at the helm, they are grand and unachievable. So, but that's fine because
But we all aspire to them.
yeah, reach the stars, fall to the moon. I that. But and I feel like I need to go do like an open university course in human rights, but
Yeah.
instead I'm just reading a children's book about it. I have to say I have graduated from my children's book to a more adult, but
Nice.
I'm not leaning to get it. But here's my book I started with. Human Rights by Yo-Yo Herrero, illustrated by Louis Demano, and translated by Martin J. Perazzo with Paul David Martin. And I have to say the illustrations are fab. I can't on the translation because I wouldn't know.
Yeah. Illustrations are top.
Yeah, it's a really helpful book. Have you ever been to the Welcome building in London? It's near the
No.
That's where I go and get all my Christmas presents for people.
Okay.
After, like, when I'm on, is that Marylebone Road, but near
I'm
Paddington?
not sure. Oh, okay. Yeah.
I know that I'm going to go into the Welcome cafe and then go to the shop there, and I'm just going to buy loads and loads of stuff.
Okay. I'm putting that on my list for Christmas shopping.
Definitely. I think they've an online shop. I'm not sponsored by nothing. Some of the best are from there. Dubai did. I talked to Annabelle Shaw Mimo, bought that. I start with the children's book. And
I think that's the best way to do it, though.
yeah, I think so.
Start with the basics and then build your way up.
I think this, okay, so human rights, the measures that nation states are obliged to implement in order for this to truly happen are laid down in a series of documents comprising what we call human rights. They consist of a declaration and a multitude of treaties and agreements that set out what rights we are all entitled to and how those rights must be respected and protected. And I used to live in Geneva, and so I think I probably am a bit more aware of this than others, just because we'd walked past the building. I think it was called the Roosevelt building or something on the right side of the river, and that's where I think that the original conversations were happening. But the most important and best known document on human rights is the Universal Declaration of Human Rights, which was passed by the General Assembly of the United Nations in 1948. And Eleanor Roosevelt which is, well, probably, yes, it probably is therefore the Roosevelt building, because I'd always assumed it was her husband, the president, but now I feel ashamed. Anyway, she presided over a UN commission that drafted the Universal Declaration of Human Rights in 1948. And why is this relevant? That was a long time ago, but it wasn't that long time ago. And I'm acutely aware of why this is relevant in rare disease and other areas, because 1948, it was after the Second World War.
Yeah.
And there had been wars before, and there's been a lot of atrocities in the past, but this was sort of seen in the time as this was meant to be like, we would call this modern history, right? Not early history. And we know about the genocide. We know about groups of people being marked differently, and then, killed like in a strategic fashion. But also there was a lot of experimentation as well.
Yeah.
So a lot of what we know about in medicine, a significant amount has come out of a pursuit for scientific knowledge by Nazis. And so it wasn't just that there was discrimination and subjugation and killing and experimentation on people based on race, gender, sexuality, but also on disability. And that is part of the rare disease story. And so I think it's absolutely natural that the rare disease community should be loud and talking about human rights. And in 1945, the United Nations Organization was formed with the purpose of saving future generations from war and creating the necessary conditions to guarantee respect and justice for everyone. And, even today, Medics for Rare Disease, our vision is equitable healthcare for everyone, regardless of, this is the parenthesis, regardless of the prevalence of their condition or who they are. We want equitable healthcare rights. And I think people might know this phrase. So this is Article 1. I think I'd be interested to know what human rights you knew about prior to this. But Article 1, I think most people have probably heard this statement, whether they know where it's from or not. But the Universal Declaration of Human Rights says in Article 1, all human beings are born free and equal in dignity and rights. And that's not the whole article, but I think that's the main principle.
Yeah.
And then my more grown-up book, I picked this up the other day. Where did I pick this one up? Waterstones.
Nice.
I went with my mother-in-law. It's one of my favorite places. Human Rights, The Case for the Defense. And it's a really recently written book. And that's by Sharmi Chakrabarti.
Nice. I'll have to get one myself as well.
Yeah. Yeah. So what was your pre-knowledge? That basically, the other thing that my pre-knowledge was as a doctor, I used to go around being like, this is breaching my human right to rest and recuperation.
Yeah.
Breaching my human right to private life and family. I think it's like Article 12 or something. Anyway,
Amazing.
From those two things.
Yeah. So yeah, my previous knowledge on human rights, I'm not an expert on human rights at all. So I think I just have like a very basic knowledge of that UN declaration that was implemented after the war. So kind of covering like the major, so a right to health, right to healthcare, a right to education. I'm drawing a blank now.
Yeah, I think I would
On
have
the
said
other rights.
I would think what I would have thought of was a few rights that are actual rights and a few rights that are not necessarily rights in the declaration, but probably fall under another one. So for me, that would be like a right to go to the toilet.
Okay, yeah.
Like I think there's like, a right to water. I think those are actually just laws in the UK that people, if you're serving something, you have to be able to give someone water. I don't know. So I think there's a conflation with laws of like individual nation laws versus rights, but definitely a right to education.
Yeah.
I think particularly cases like Malala standing up to have an education and being shot by the Taliban is, that's quite high profile.
Absolutely.
I think a right to health, definitely, I've known about. And
I think there's, as you say, there's so many other rights that come under that and laws that come under that and are implemented. But I think a lot of the time when you don't have much knowledge on human rights, it's just you look at those overarching, like bold statements like right to health, right to education. But you're absolutely right in that is that you have the right to attend school, you have the right to go to the toilet for your health, like you have the access to water, etc. But I think that can be quite intimidating sometimes to look into those rights and actually apply it to your situation if you don't have that in-depth knowledge, which is, I guess, sad in some ways because those rights apply to everyone. Like everyone has the right to rights. That doesn't sound right, but the right.
You can't, as we know in the rare disease world, you can't advocate for yourself if you don't know what tools are available to you.
Exactly.
And I think sometimes I bring this up with the rare community, which is sometimes I think it can be so insular that people are fighting for things that are already enshrined in law.
Yeah.
Not trying to make a new pathway.
Yeah.
Just go, not saying that's easy. I mean, goodness.
It's not at all, yeah.
The thought of having to take on a lawsuit or claim, or it scares me so much, and it costs a lot of money. So I'm not trying to say it's easy, but nobody's going to create a new pathway when there are laws already in place to hold the state or to hold an employer or a company accountable under, say, something like the Equality Act of 2010 or something like that.
Yeah.
So it's
And I
important
think
to know what we already have, because otherwise we could be like fighting something that A, already exists, but B, no one's going to pay attention to.
absolutely. And it's highlighting that as well. I guess in some ways it's like empowering people as well that, okay, this is already in a legal framework that should be actioned, but it's not.
Yeah.
So,
Why? So that's us,
so
isn't it?
why?
So
Yeah.
we're the why isn't it?
Yeah.
Why is social injustice a thing? And
Yeah.
I'm thinking about, I was looking at my big orange children's book about rights. For anyone who is only listening, this is my only regret about buying this book is I don't have a bookshelf that fits it into, because it's so tall and hardback. But in a way, I think that's a really good idea, because it means it's hanging around for people to pick up and look at and stuff,
Yeah.
instead of being buried on a shelf.
Yeah.
I'm looking at the different articles and just thinking in the UK in the last 5 years, we know that there's a problem with modern slavery in the UK.
Yeah.
There was an NHS staff survey that came out earlier this year showing that people were being staff were being discriminated against based on their ethnicity. There was, if you think about wrongful arrest and wrongful arrest where there has had to be payment, there were quite a few there were arrests around the coronation, for example. There was a famous one in Oxford where a professor got compensation because he was arrested for saying something that wouldn't be counted as a illegal offence. There's the curtailing of the right to protest, so peaceful demonstration, which is in the news at the moment. The protection of rights of like women and babies, and I think there's been a recent thing about baby deaths in the news. Equal pay and choice of work. So Article 23, equal pay we know is an issue. The choice to have work, which we know has been in the news around PIP. And I think the UN may have even made a statement about what's happening around PIP in the UK. And then yeah, I think there was also a demonstration about women being able to go to work with babies as MPs. So there's, anyone should be able to take part in parliament and democracy, but women not being able to take, new mothers not being able to take their babies into parliament. I think there was a whole. So that's just, if this is not something of the past. And I think that's where the case for the defense is really helping. This is a continuous struggle. And I think that rare disease, there are some groups that have been later specifically recognized because they've had to struggle specifically to get rights, to get that social justice for them.
Yeah.
And so therefore, because social justice hasn't been given to them based on the human rights that there are, they then have, things, I think there have been amendments. So that's particularly like Indigenous groups, women, people who've struggled against racism, children's rights, that was an addition. But children's rights, people with disability and people from the queer community, so LGBTQIA+ community. So one of my thoughts when I was really sort of getting into this was, when you're looking at these groups and what they've been through, in a world where there is a universal declaration of human rights, and yet they're still not having those observed. These individual groups have had to struggle to get to the point where their rights are observed. And just makes me wonder that if maybe that's where we are at this point in time, that we're on this journey with rare disease.
Yeah, absolutely. And yeah, you're completely right. Like, it is a present day issue, like, because that declaration was published in the past and there's been new updates, like, it's a continuous process, basically. Just because the legal framework is there doesn't necessarily mean that it's up to date or being followed, I guess, like you said. So I think it is important. And I think, I think it is very applicable for people living with rare conditions as well.
Yeah. I think there was something, paragraph in here that made me think. Here we go. This is Shami Chakravarti. In a healthy political community, comfortable in its skin, and which debates the application of human rights in policy and lawmaking, judges need not become overly politicized, nor need human rights invade, rather than inform, the business of elected governments that respect the rule of law. So the idea is that if you are a nation with a healthy political discourse and climate that is having its law and policy informed by human rights and the equal right to dignity, then you don't need to worry. But if you're not, then you will then get activism, and that, this is potentially just a constant struggle. But with rare disease, I think it's this, that we're building on it up to a point of this group needs recognition as a specific marginalized group, like others have done in the past. And that, and this is about universal recognition of this group.
Yeah.
And when I first got into the commission and people were talking about, we want it to all be about visibility, I was skeptical a little, just because what does that mean, visibility of something? There's lots of things that are visible, but is anything really happening to change it? But actually, now I really start to see it. This is about universal recognition, universal visibility of this community. Like, if you think about even in the 80s, the visibility and the recognition of rights for people who are queer, just very different to now. Doesn't mean that those people are still not discriminated against, that this is a solved problem, but there is a visibility for them. And really, maybe this is a movement toward people impacted by rare conditions truly being recognized as equal in dignity and rights.
Yeah, absolutely. I completely agree. And I think,
we've solved that. 10 o'clock, Wednesday, 16th of July, done.
Tick, done. But I guess, I agree. Like, visibility, it can mean so many different things. Like, it's like visibility, what does visibility mean for different people? But
it has to start. I get it.
It has to start.
It has to start. You have to be counted and recognized. And I remember
that awareness globally as well.
I think it was Duane from Rare Disease International. I think her who once said, if you're not counted, if you're not counted, you don't count. So if people don't, if people don't know about you, if they don't know your numbers, the data about you in this modern day, you just don't count, because you can't quantify or qualify nothing. If there's no data, if there's nothing there, we can't hold people to we can't hold people to account. We can't enforce what tools we do have. So they've got me. I get it. It's all about visibility. Anyway.
But I think also the evidence generation and the fact that there's going to be evidence-based recommendations. I think for me, that was the part that was like, okay, visibility is one part, but then also followed up with, okay, here's an action, here's a recommendation.
Yeah, I mean, there's times in my big children's book. Maybe we should, next time we talk about this on the podcast, I might sort of look at the timelines of how long it might take from a few activists to, a real change. Or maybe that's a futile, maybe that's a futile thing, because when do you say that change is finished? But if you think, for example, the struggle for women that continues to be seen as equal in rights and dignity, truly, that still continues, and we know that that's a centuries long struggle. But anyway, on that
Yeah.
bright note, anything else to report?
I don't think so. I
No.
think we've
We've
we've covered it.
Yeah, done. Okay, we'll let the commission know. Let Lancet know.
Yeah.
Oh, and looking forward to a webinar about Delphi studies later. So
Yes.
if you're listening to this podcast, that has already gone. But let us know if you'd
Mhm.
like to.
Yeah, it's being recorded, so
Yeah. Okay, Megan. Well, thank you so much for joining me today, and
thank you
also
so much for having me.
being a complete legend on this project. And a huge shout out to the Lancet, Chloe at the Lancet, Rare Disease International, all the commissioners and everyone who has got us to this point. And we're very glad to be carrying the baton with everyone.
Absolutely. It's incredible work. So yeah, thank you very much for inviting me on.
Yeah. Take care.
Thank you.